The following program is presented by Pain Free Life Centers of Michigan.
News Talk 760 WJR presents Living Pain Free with host Warren Pierce and special guest Jeff Morton. For WJR, here's Warren.
All right, Mark, welcome in, everyone. If you're in some sort of pain, you know somebody in your family who is experiencing that, maybe somebody that you work with, you've come to the right spot on your dial, because between now and 8, our special guest is going to do his best to eliminate and reduce that pain, whether it's aching or burning or stinging or stabbing or throbbing. Pain gets on your nerves. And when chronic pain strikes, maybe it's sudden, maybe it's been coming on for a while, signals a warning, really, that something's wrong in your body. It's time to take action. And that's what the next hour is all about. Chronic pain is a pain, for those of you who are trying to figure this out, that persists. And then that pain will place a burden on your everyday life. Unrelieved chronic pain can drain your energy, keep you off your feet. Pain signaling in your nervous system, for example, that you may need someone like the Pain-Free Life Centers to be sure. It's triggering depression, anger, anxiety, sleep loss, and the inability to work. And Jeff Morton, between now and the top of the hour, you've been doing this for years now, using a laser to begin to reduce and eliminate pain, to avoid, for example, drugs. Maybe our listeners start with over-the-counter drugs, things like Tylenol or ibuprofen, those kinds of drugs, and then they get, who knows, prescribed to other stronger drugs. The opioids that we've talked about, that has become, certainly everybody's buzzing about it now, it's become an epidemic in our country as a result, in part, to people who are experiencing pain and don't go and get the laser treatments that you offer and have been offering for years now.
Well, you're right, Warren, and opiate abuse is a problem in the United States, and it's caused by the drug companies because the doctors prescribe the drugs to help people manage pain. Part of it's our society. People want instant gratification and instant relief in their pain. The laser is a process, and we call the process photobiomodulation, which is a big fancy word, but it's really simple. Photo is light, bio is life, and modulation is change. Science has proven that human cells respond to light. So our high-dose laser therapy is able to penetrate below the skin to the damaged cell, give that cell the ability to produce energy called adenosine triphosphate, or ATP. That energy makes that damaged cell healthy. Healthy cells create healthy tissue. That increases blood flow, and it stimulates the body while it's in the photobiomodulation process to release nitric oxide, which is our body's natural anti-inflammatory. So 90% of the pain in our body is caused by inflammation. Anything with itis, arthritis, bursitis, tendonitis, plantar fasciitis, those are all inflammatory conditions, and how the body heals with those is increasing the blood flow, carrying oxygens, enzymes, and proteins, and reducing the inflammation so the body can actually heal itself. We treat everything from migraines to plantar fasciitis to neuropathy, whether it's diabetic neuropathy or chemotherapy-induced neuropathy. 70% of our patients, lower back issues, sciatic nerve pain, piriformis syndrome. And the best
rotator cuff injuries.
Oh, sure, yeah.
Carpal tunnel for those who work on computers all day long.
Yeah. And the best thing is the laser's able to pinpoint the source of the pain, totally non-invasive, without any side effects. And we're in our 7th year right now. So we're just growing, and we have people come from all over Michigan, Ohio, Canada. I've had people fly their parents up from Florida. I've had husbands bring their wives. I've had wives bring their husbands. We treat student athletes, professional athletes. We're the #1 laser pain center in Michigan, and nobody else in Michigan offers high-dose laser therapy. And we'll get into that, the difference between high-dose and low-level laser, which is what you're going to get anywhere else. I'm very passionate about this. I see opiate addiction every day. We treat scars every day. The laser will remediate scar tissue. It will reduce bone spurs, calcium deposits, and really allows the body to heal itself on its own. It's amazing what we do.
And I just saw this article that came out it was published by the University of Michigan. And it suggests, and you were alluding to it, doctors are prescribing 50 to 75% more addictive painkiller than they need. And in fact, in the United States, patients are prescribed, what is this, hydrocodone, which is like Vicodin, I think,
Yep.
or Norco, or whatever that is.
Norco, yeah.
75% of cases post-surgery. So folks have gone in for surgery to alleviate the pain, and the doctors are then giving them painkillers after they've gone to surgery?
Well, because when you cut the body, and this is one of the things that I stress to every patient that comes into our centers, is surgeries may be necessary, but it should always be your last resort because you can always get cut. You can't get uncut. And the body, it creates scar tissue. The nerves get cut. The muscle gets cut. The tissue gets cut. The vascular system is disrupted. So how does the body heal? Creating itself and putting together, it creates pain. And so, yeah, people go in for surgery and they come out of surgery, and what do they need? They need to take pain medication so they can heal. We're having more and more orthopedic surgeons send us their patients after surgery because we can manage the pain and it allows the body to heal 60% faster. And Jared Allen, who used to play for the Carolina Panthers,
Yep.
I talk about it all the time, had a fractured foot 3 weeks before the Super Bowl, got laser therapy 3 times a day, 7 days a week, and that fracture healed in 3 weeks where he was able to play. So this is what we do at Pain Free Life Centers, and I urge the listeners, and I treat everybody like they're a family, to call the office and talk to one of the wellness coordinators and book your appointment because we're so confident in what we do. Your consultation is going to be free, and your first treatment is absolutely free. We got Michaela, Marissa, and Natalie standing by at 248-879-1100, and they can answer any questions for you. We have a completely certified and trained staff, and we're the best in the country.
And we're going to be taking questions, too, from those of you who are experiencing pain. You've tried just about everything, maybe even surgery. You need to call Jeff Morton this evening. We'll open up our phone lines. Whatever your pain, whatever your member of family's pain is all about, somebody that you work with, as we suggest, there's 100 million plus people who are experiencing pain, and you usually bring to a patient or two with you to talk a bit about the experience they had when they went to the Pain Free Life Centers that started in Troy, and now you're in Shelby Township, and you're getting ready to open in Bloomfield Hills too. So it's real. The word is spreading,
yes,
and it's out there. And let's be honest here, there are some other doctors who are trying to use laser, whether they are dentists, whether they're other practitioners. But they don't do that all by itself. This is what you specialize in.
It's the only thing we do at Pain Free Life Centers, and I actually appreciate the fact that doctors, orthopedic surgeons, chiropractors are getting into laser because it just adds credibility to what we're doing. The problem is they're using low-level lasers because Pain Free Life Centers has the exclusive rights to high-dose laser therapy in the state of Michigan, and so it's like flashlight therapy. There's a big difference. You need to have the proper wavelength. You need to be able to have the proper amount of energy or the joules from the laser to go into the body to create the photobiomodulation, which is the healing process, in order for the laser to work. And the other thing is it's a cumulative treatment, Warren. You have to come in 2 to 3 times a week. There's a series of treatments that we put you in. If whatever your condition is, you'll meet with a wellness coordinator. You get your consultation, your treatment is free, and then we put you into a program, and the program works. And we really develop the protocols to know what works for spinal stenosis versus osteoarthritis or plantar fasciitis versus neuropathy. The doctors, it would be a full-time job for them, but they don't, we get a lot of referrals from doctors because they don't know what to do with some of their patients. With drugs, the more drugs you take, the more drugs you need because your body builds a resistance to the chemical. With laser, it's the opposite. The more joules we give you, the less laser therapy you need. Once the photobiomodulation process starts going, we just keep that cycle going. So it's a pain management. We don't cure. It's pain management. But it beats taking Narco or Oxycontin and killing your liver and upsetting your digestive system.
Or going under the knife. And we're going to
Right.
open up our phone lines, too, for those of you who have any kind of pain and you want to know how to reduce and begin to eliminate it. As usual, the direct line here to WJR is toll-free, 1-800-859-0957. So get in, get online, and you'll also want to make an appointment, too, because they really fill up after we spend this hour with Jeff, the director of the Pain Free Life Centers. And we want to talk, too, to one of those, or maybe two, who have visited you. You brought them into the studio. We'll chat with them as well as we continue here on News Talk 760 WJR.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
In Troy, started in Troy. They're now in Shelby Township. Will soon be in Bloomfield Hills, going and growing to be sure to take care of the, as we mentioned, over 100 million people who suffer from chronic pain, which means, and I know, Jeff, you've brought in one of your patients here, driving a car can become difficult, going to the supermarket could be tough, sitting at a desk, whatever is very daunting. And the patient that you brought in this evening, along with his wife, Nancy's here too, Richard Tepper, fill us in on how you eventually got to the Pain Free Life Centers. What was it, earlier this year that you had a hip problem going on that you hadn't experienced prior to that?
Well, I was having some pain in my left hip, and it was getting a little bit worse, and I was getting concerned that maybe I needed a hip replacement. So I went to the orthopedic doctor, specialist, and took x-rays, came back and laughed at me, and he says, I thought I was going to replace your right hip because it looked bad, but your pain's in your left, and there's nothing wrong with it. You have tendonitis, bursitis. So Nancy had been treated about 4 years ago for an injury in her right rotator cuff, and Pain Free corrected that. I believe that was even not as deep a laser as a powerful laser they have now. And then earlier this year, she had same thing in her hip. She had pain in her hip and had been treated, and that went away. So I went to the same orthopedic doctor, and he gave me the diagnosis I just described. And he gave me a prescription for therapy. And if I wanted to take over-the-counter drugs or live with it.
Right.
Well, I wasn't going to go for therapy because they put through pain, right? VT means physical torture. So not physical therapy.
You can write that one down.
Yeah,
right.
So in any event, I knew from the experience that she had that it works. So I went and signed up with them in early, I believe it was early September, right after Labor Day, and it's great. It works. A doctor told me about 25 years ago when I had some golf elbow tendonitis. He said it takes months. All of a sudden, one day you wake up, musculoskeletal, takes a long time to heal, and he's right. That went away eventually, but so I was impatient. This works faster, and it's fantastic. I would recommend it to anybody who's got musculoskeletal issues or other things that Jeff's going to describe.
What kind of impact was that left hip, after you thought it was the right hip, what kind of impact was that having on your day-to-day life?
Well, going up the stairs, down a little bit, but up the stairs was really painful, very painful, number 8 maybe.
And, out of 10, right?
Out of 10, right. And so, I said I was getting worried. That's why I went to the doctor and diagnosed it as a tendonitis. He says, you don't have nothing wrong with your hip. It's your muscle that's got inflammation in there, and it's going to take a while to heal. And if it doesn't heal, just live with it, right? Well, no way. I knew this would work, so I signed up for. No way I was going to go through physical torture. So,
Jeff Morton, have you heard feedback from those who you've treated for pain over the years that physical therapy can be difficult and painful.
Well, it's interesting because I learned this from John Wharton, who was the trainer and strength coach for the Red Wings for 12 years. He worked for us a few years back. And physical therapy is the proper thing to do at the right time. So when the body's inflamed and has inflammation is causing the pain, most of the time the doctors have to prescribe physical therapy or physical torture, as Richard says it. That's a good one. I never heard that before. I have to remember that. But because the insurance companies require it, right? So this is the non-insured modality that we offer, even though it's FDA cleared. The medical insurance won't pay for it, but auto and workers' comp will. And we are very close to deal with the VA. I can talk about that tonight because we have a meeting Wednesday at the John Dingell building here in Detroit with the head of the VA to help our veterans. But so what happens is they come in and they get their laser and they get better. And it's a very interesting process to see patients that don't want to have the surgery or don't want to take the medications, that they come in and they get the laser.
Well, I can't believe anybody would want to get surgery. I can't believe anybody would want to get hooked on, well, from over-the-counter to prescription to opioids. People don't want to do that. But as you know, Richard Tepper, and you probably can relate, people who are experiencing pain like you will do anything to somehow, some way, stop that pain.
Absolutely. It really takes away the quality of your life and the things you want to do, bending over or stepping up on steps, or I just didn't want to live with it anymore. And I knew like maybe the physical therapy works, the physical torture, but I wasn't going to go through that. And insurance would have paid for that, but no way. I would rather have taken this treatment because she had great success. Nancy had great success twice with that. So I definitely went
had your wife not experienced that, would you have in any way, shape, or form been apprehensive about a location where they use a laser, non-invasive, doesn't even touch your skin, you go in for 15 or 20 minutes on a number of treatments? Would you have at all said, what's the deal here?
No, I don't think so, because I think this was the latest technology, and listening to what it was going to do, I would have given it a chance. I was not apprehensive at all. Even if she didn't do this and never had the experience, I probably would give it a chance because it just seemed a better path to try before going through physical therapy.
You didn't have to bring in really any X-rays or MRIs?
No. I had the diagnosis already, so I knew what I needed, and since this was able to treat it, I went ahead with this plan.
And Jeff Morton, you really don't need MRIs or X-rays. All you need to do is let someone like Richard point to, okay, here's where the pain is, and then your experienced technologists go in and they begin treatments.
Well, there's a pretty comprehensive patient intake form on our website, painfreelifecenters.com, that the patient fills out. It's about 6 pages, so we get some medical history. We don't diagnose at Pain Free Life Centers. But our patients know what they think they have. I mean, sometimes they come in misdiagnosed, and we figure that out.
But they know where the pain is.
And because I've been involved with laser therapy for over 9 years, and we've been treating patients for almost 7, we know what to do and we know where to treat. And like I said at the beginning, anything with the itis at the end of it is inflammatory. And Richard had bursitis in his hip. So what does the laser do? It increases blood flow and reduces inflammation, and that's why he's able to get pain relief. It's not a cure, but it is pain management without side effects.
And we're talking about improved vascular activity. It promotes healing, whether you have, Achilles tendonitis or bursitis or fibromyalgia or heel spurs or carpal tunnel or knee pain, migraines, you name it. This is the spot to stop. The consultation is going to be free. The first treatment is going to be free. And we want to take some of your incoming calls, too. If you have a pain, someone you know has one, give us a ring and we'll put you on the line with Jeff. And he'll tell you exactly what he can do for you, how long it might take, how many treatments you need. Our number, toll-free here, is 1-800-859-0957. We got some folks waiting to talk to Jeff, and we'll do that momentarily. But if you want to join and figure out exactly how you can reduce and eliminate eliminate that pain. The number to call is 1-800-859-0957. And we're back with some of your calls here on News Talk 760 WJR.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
In Troy, out in Shelby Township now, soon to be in Bloomfield Hills as well, doing our best to help those of you among the 100 million who suffer from some sort of pain to begin to reduce and eliminate that. You can ring us up at 1-800-859-0957, and we'll see what Jeff can help you with at this point in your pain situation. In fact, let's go to Shelby Township, not all that far away, I would imagine, from one of your locations there, Jeff. Jerry, you're on News Talk 760 WJR. What kinds of problems were you experiencing?
Hi guys, how are you?
Great.
I've got a knee issue where I went to a couple of different prominent surgeons, and they both said that I've got a wear on one side of my knee, so I need a partial knee or a full knee replacement. I'm an active guy. I ski out west, and I do all kinds of physical activities along with working. And my biggest thing is I'm looking at the X-rays, and there is a slight gap difference between the two, but I don't necessarily know at age 57 if I want to go through a knee surgery that will basically, might last 15 years if everything goes good. So I'm hoping, I live 15 more years, but maybe the whole situation with this laser therapy might be something that could help me manage the pain. I'm okay walking pretty much, but going downstairs, there's a little bit of pain, and upstairs not really, just mostly going downstairs.
Kind of reminds me a little bit, of Dave Rosema?
Yeah.
One of your patients who had, 5 arthroscopic surgeries when he was before and after pitching for the Detroit Tigers.
Yeah. No, Jerry, so we're about the same age, and I can tell you that you said if everything goes good, and I can't tell you how many scars that I treat. It's the really good friend of mine works for Stryker, who probably is going to make the knee that they're going to put in, and the technology is changing so quickly, and I truly believe that if it's not a structural issue and it's a pain issue, the laser will reduce the inflammation in the knee and allow more synovial fluid to lubricate the joint, and that's going to take care of the pain, right? That will happen, and 3 to 5 years stem cell research and stem cell injections, where they may be able to inject the knee and grow the cartilage back. But if you're not full bone on bone and you don't have a structural issue, you're our perfect candidate, and we're right at 24 in Shaner, so we're right around the corner from you.
And you get
I'm at 25 in Jewel, so I'm very close.
Yeah, you could even, I would say you could walk there, but obviously you'd be in too much pain, so you'll have to drive over there. But mark down the number, get the free consultation, get the first treatment free. Did you note the number there, Jerry?
Yeah, I think I know where he's at, 23 in Shaner.
No,
Southwest corner, medical.
Yeah, 24. It's in the Stonebridge Medical Center.
Yeah, but you got to make an appointment. You got to make an appointment right after.
I will show up at the door tomorrow, and I say the Jeff said I could come in.
Yeah, you do that. But Jerry, seriously, go online, read some of the testimonials. There's a couple of videos on our website, painfreelifecenters.com. And then download the patient information form and fill that out before you come in. That'll save some time. But talk to one of the girls and make your appointment. And listen, I'm going to Snowmass in February, so I got knee issues too. I treat my knee almost weekly, so it's ex-college athlete.
Right, but good luck, Jerry.
Hey, thanks a lot. lot, guys.
You're welcome.
I'll see you. I'll see you at the office if you're there. Jeff. Take care.
Okay, take care, man.
He's
Thanks.
there bright and early. In Sterling Heights, Joni, come in. You're on News Talk 760 as we're talking about your specific pain problem. How long have you had it?
Good evening. I have had this about 3 years, and it's progressively getting worse. It's on my right foot, and I've got bunions that have appeared over the last 15 years.
Right.
And I don't have a problem with those. I just get a wide shoe. But I'm 57. I've had 2 knee replacements due to structural issues. I have bad arthritis.
Okay.
And now the right foot is every morning I get up, it hurts to walk. I'm literally walking on the heel and the side of my foot. It's been diagnosed as a little arthritis, but I'm not going to go under the knife. There's too many bones in my toes.
Yeah, right. So I'll tell you this. I don't know if you've ever listened to the show before, but 2 months ago we had a 73-year-old gentleman that was a guest. He was a patient of ours. He was up from Florida, and he had an ankle issue from when he was like 16 years old, and at 70 the doctors wanted to fuse his ankle and he refused to do it. He is now playing senior softball 3 days a week down in Florida without pain after going through our treatments. Mm-hmm. So the arthritis it's what the laser does. It reduces the inflammation by increasing the blood flow and allowing the body to release nitric oxide, which is your body's natural anti-inflammatory. So it's tailor made for you. You're in Sterling Heights, so either Troy or Shelby's will be closest for you, and you should feel some results the very first time. I mean, that's how confident we are. I mean, I have people that come from Cleveland and Columbus and Bowling Green, all over Canada to get these treatments. But it's
I've been listening to you for years, and I'm on a radio talk show junkie, and I thought, I'm going to make the call.
Good for you.
All right. Do you have the number written down?
I had it written down, and I'll be calling tomorrow morning.
No, you've got to call because they've got the specialist standing by over there in the office now in Troy. So give them so you make the appointment because it really fills up. So if you wait maybe till tomorrow morning, it'll be too late, or you'll have to wait too long.
Tonight.
All right. Call right after you get off the phone with us, and good luck. All right, Joni?
Fantastic. Thank you so much.
You're welcome.
Thanks, Joni.
Do you see more men with pain or women? Do women tolerate pain more than males do?
It's interesting. Our female to male patient ratio is probably 55-45, but we have more women that call in for their husbands because they whine. And so, but I think women have a higher pain tolerance than men from what I see. But it's really 55% women, 45% men, but mostly the guys are tougher and they don't want to make the call and their wives get tired of listening to them, or they're becoming couch potatoes or getting lethargic and gaining weight. And, you got to stay active when you get older.
But, and again, we've mentioned this before, if you've got pain, it not only affects the individual, but it affects those around you, the family, people that you're working with as well, right?
Oh, absolutely. Yeah. I mean, that's what's interesting too, is like Nancy, Richard's wife, was my patient before Richard, and because she got such great results, Richard became a patient.
All right, let's get Doug in here quickly in Canton, Michigan. Doug, go ahead. You're on News Talk 760 WJR. What did you want to ask Jeff about concerning your particular problem?
Well, the previous caller prior to the young lady, I have the same problem in my hips, and I can't seem to. I've been to 2 orthopedics, and one said that I was bone to bone, and another one said I wasn't that bad. But my pain in the last 4 months is getting just crazy. I just came off a 7,400-mile motorcycle ride, and actually on the bike, it didn't hurt that bad. But now that I haven't been on the bike in a month, it's just the pain is just getting more intense by the day.
Well, Jeff Morton here, you got a biker buddy. You here.
I went. I went out west on the Harley, but I'd get cramps, but it wasn't that bad. But now it's just if I'm sitting or if I'm walking, I'm okay. But when I'm sedate, the pain just starts.
Yeah.
It's getting. Go ahead.
No, so what I was going to tell you is the reason that is because you probably have some type of bursitis issue or arthritic issue, and when you're staying still, the synovial fluid can't lubricate the joint, and so when you get up, it's pain. Richard is really one to talk because that was his issue, and you guys kind of have the same type of condition, and I can let Richard tell you his experience with Pain-Free Life Centers from himself. I mean, I have the perfect guest on for you tonight.
And Richard Tepper, can you relate to what Doug is experiencing here?
Absolutely. I had a similar situation. The pain was worse going upstairs. But, after I would sit for a while and first get up, it's just, he described it, why it happens. The lubrication's not there. You start moving around, it's okay. But certain motions, that's where you get the pain, right? It didn't hurt so much walking, but up the stairs, or some down, mostly up the stairs, a bending over, maybe a certain kind of bending over, I'd get the pain, and it works. As I'll always remember what my old family doctor said about 25 years ago. Musculoskeletal injuries take a while to heal. So at those days we didn't do anything. It was no pain-free, right? You took medication or just live with it, and maybe 6 months, 9 months, or a year later it goes away. But today we can't wait for that. There's a way to get that healed up.
On a scale of 0 to 10, what's your pain number, would you say, Doug?
In the last 3 weeks, I'd say I'm up to a 7 or an 8 from like a 3 or 4 2 months ago.
Yeah, and here's the thing, Doug, and this is what I tell the patients that I see. My job is to educate the listener and to spread the word that there is a choice to the drugs, the injections, and the surgery, and it works. This is the same type of modality that professional athletes are getting. The Pittsburgh Steelers have these. The Michigan State Spartans Go Green have them.
University of Michigan
in their training room, they have them. And we're bringing it to mainstream. So we're kind of pioneers, but we've really developed the protocols. And what's really great is I know this will help you, and it's about your quality of life. What's like, do you want to live like this or do you not want to live like this? It's really your choice, and my job is just to educate you, to let you know what we can do. And I would,
I haven't taken any medications at all. I've been trying to live with it.
Not even like Motrin or.
No, I've taken 2 Motrin probably in six months.
Wow.
I lost a brother to opiates about 3 years ago, so I'm pretty anti-opiate. So I try not to take no meds. But I heard this on the radio. I just happened to hear you guys, and I said, maybe this might be up my alley.
All right, so take down this number, and after you hang up,
I did. I've got it.
248-879-1100. Right after we say goodbye, call them because they're standing by over there at the Pain-Free Life Centers. And remember, the consultation is going to be free. The first treatment is going to be free as well. So give them a buzz. The wellness coordinators are waiting for you to call right now, Doug. All right?
Okay. Now I have one question.
Yeah.
If I have a bad hip and it is bone to bone,
right?
Does your treatment work for that, or would you refer and say you need a hip replacement?
Okay, so that's a really great question. So it's a 2-part question. Yes, the laser will reduce the inflammation if you're bone on bone and allow synovial fluid to get in and lubricate the joint and help manage the pain. If you wind up needing a hip, we have patients come back right after their surgery because the laser will decrease the healing time by 65%. It will eradicate any scar tissue that's going to grow around the joint, because that's most of the hinges that get replaced. The problems with that are nerve impingements and scar tissue, limiting range of motion. So it's 2 sides, right?
Right.
You can always, what I tell everybody is, you can always get cut. If you were my brother or my dad, I don't know how old you are, I would tell you to flip over every single stone before you have surgery, because I'm a diabetic. I'm 59 years old. Yeah. So I mean, you don't want to have surgery. And, this works with neuropathy too. So if you ever start to feel the numbness, tingling, and burning in your feet, don't ignore it, because the laser will improve nerve function and allow the myelin sheath to regenerate over the nerve. We actually can help heal neuropathy. So if you're on Lyrica or Neurontin, we can get you off those drugs as well.
All right, Doug, give him a buzz right now, all right?
Good enough, guys. Thank you.
Good luck. Thanks for calling in as we begin to slowly but surely close out an hour with Jeff Morton and the Pain Free Life Centers. And we're back here on News Talk 760 WJR after these messages.
If you'd like to see how laser pain therapy can change your life, call Pain Free Life Centers now to schedule your initial no-cost consultation and free treatment. Wellness coordinators are standing by now to take your call at 248-879-1100. You have nothing to lose but your pain. Once again, that's Pain Free Life Centers at 248-879-1100 or visit painfreelifecenters.com. We'll be right back with Warren Pierce and Jeff Morton, Director of Pain Free Life Centers, on News Talk 760 WJR. Welcome back as Warren Pierce discusses the path to a pain-free life with Jeff Morton, Director of Pain Free Life Centers of Michigan. Without drugs, without surgery, and without side effects, laser pain therapy is a revolution in pain management. Once again, here's Warren Pierce.
In Troy, branching out now in Shelby Township, soon to be. What do you figure you're going to open in Bloomfield Hills before the end of the year?
Yeah, we're shooting for some time between Thanksgiving and Christmas. I was hoping for Thanksgiving, but definitely by the end of the year. Just north of Carl's, on the same side of the street, Carl's Golfland, where Arthur Murray Dance Studio used to be.
Right.
So it's going to be a rockin' location, and we're looking forward to servicing the Bloomfield Hills, West Bloomfield, Commerce, Waterford area.
And Richard Tepper, as a patient, now a former patient of the Pain Free Life Centers, you had that left hip problem. You had a pain number of 8 or 9. You go in there. How many treatments then did you get to begin to reduce and eliminate that pain? And what were those treatments like?
Well, the treatments were about 20 minutes duration, and it took about maybe 8 to 10 before I started seeing it come down. You have to be patient. Okay, you can't, it's not instant. Okay, healing is not instant. I'll still remember what I said this doctor told me 25 years ago. Musculoskeletal takes a while. And so I knew that, and I was patient. And after about 10, it started getting better. After 20, it was maybe 15, it started really getting better. It was a gradual improvement. So I'm down to about a 2, okay, after about 22 treatments.
And Jeff, we talked about how lasers have been around for like 30 years now, FDA cleared.
Mm-hmm.
I want to say maybe a dozen years or so ago, with the first ones being used on animals, and then athletic trainers started treating injured athletes, and now obviously it's available for everyone.
It is, and you know, we're kind of proud to be the pioneers, Pain Free Life Centers, in that industry. You know, we've signed a contract with a service-disabled, veteran-owned small business to be their official pain management and wound care division, Spartan Medical out of Maryland. Nothing to do with MSU, but it just happens to be called Spartan Medical. What's a warrior? Spartan, right? So, and so we're working on that with the VA, and that's very close to being finalized. And then with that program, we'll get the veterans in and get them treated, and the Department of Defense will pay for it. And so, you know, keep them off their opioids. That'll reduce the PTSD. That'll reduce the amount of veterans that commit suicide. And we're a big proponent for our veterans. We hope to have that program all done, hopefully by Christmas too. We got a big meeting next week, like I said, at the VA hospital. But, you know, my message to the listeners are, you have a choice. And you don't need to take the drugs. You don't need the injections. And you don't need the surgery to manage your pain. You need Pain Free Life Centers.
And call the number now. Again, the first consultation is going to be free. The first treatment is going to be free. 248-879-1100. Or you can go online as well to the painfreelifecenters.com. Simple as that. And thanks for bringing Richard by as well. Good luck to all our listeners. Stay tuned for Michigan State Next.
The preceding program has been presented by Pain Free Life Centers of Michigan.